Welcome to Nursclex, Enhancing Critical Thinking. This is lesson number 1. Peritonitis Concept Map. Concept mapping is a visualization tool that will help you organize your assessment data. It will also help with identifying patient issues, determining the nursing diagnosis, as well as nursing interventions, and lastly, evaluating the outcome. Now let's begin our lesson. Today's topic is on peritonitis, which is inflammation of the peritoneum. Let's begin with pathophysiology. In the peritoneal cavity there is leakage, also bacterial proliferation, which is a rapid increase in numbers of bacteria, and edema, which is exudation of fluid leaking out of blood vessels into nearby tissues, cells, proteins, solid materials, fluid leaking from areas of infection or inflammation, which is called pus. We also have invasion, which is caused by increasing amounts of protein, white blood cells, cellular debris, and blood. Intestinal response with hypermotility is excessive movement of the intestinal tract, and paralytic ileus, which is an intestinal blockage, which causes accumulation in the bowel filled with air and fluid. Let's look at risk factors. Main risk factor is sepsis, a life-threatening complication of an infection. This can cause a cascade of changes that lead to organ damage, then leading to organ failure, and sometimes it can be fatal. There are two types of peritonitis. The first is spontaneous bacterial peritonitis, which is inflammation and infection of the acidic fluid in the peritoneum, caused by liver failure or kidney failure, which causes ascites in the abdomen. The next one is secondary peritonitis, which is caused by a ruptured organ in the abdomen. Now, which bacteria are associated with peritonitis? Escherichia coli, Klebsiella, Proteus, Pseudomonas, and Streptococcus. Ruptured organs that are associated with secondary peritonitis are from GI disorders: ruptured stomach ulcer, perforated colon, appendicitis, pancreatitis. Diverticulitis is caused by the diverticula, infected pouches in the digestive tract. Appendicitis, pancreatitis, and diverticulitis are all acute inflammatory intestinal disorders that can possibly cause peritonitis. What complications can cause peritonitis? Abdominal trauma, which consist of gunshot wounds, stab wounds, motor vehicle accident, and assault and battery. Which medical procedures can cause peritonitis? Gastrointestinal surgery, feeding tubes, and peritoneal dialysis for kidney failure patients. Because of poor hygiene or contaminated equipment, will cause an infection. The clinical sign of peritonitis for peritoneal dialysis patients is cloudy dialysis fluid. The vital signs for the patient will consist of a high temperature between 37.8 to 38.3 Celsius. An increased heart rate. The patient will be in much pain. Guarding the abdomen. Signs of pain can be dull, generalized, widespread, diffused, constant, or localized and intense. The clinical manifestations of the patient are tenderness in the abdomen, which can be extremely tender. In the localized area, abdomen will be distended with rigid muscles, and any movement can aggravate the pain. The peritoneum is infected within 24 to 48 hours. Signs and symptoms of the patient are nausea and vomiting, loss of appetite, diarrhea, constipation, fever, fatigue, and confusion. The diagnostic labs will show changes: elevated white blood cell count, altered levels in potassium, sodium, chloride. Diagnostic procedures for the patient are: an X-ray reveals air and fluid, distended bowel loops. An ultrasound reveals abscesses and fluid collections. A CT scan reveals abscess formation. An MRI reveals diagnosis of intra-abdominal abscesses. Medications. Patient will need fluids of isotonic solution, analgesics, for pain, intubation and suction to relieve abdominal distension, to promote intestinal function, and antibiotic therapy, which is initiated early, for infection. Surgical procedures are done to remove source of infection. Excision means removal, for example, removing a lump or growth. Resection means removal of tissue or damaged organ. Fecal diversion with an ileostomy or a colostomy. The nursing assessment consists of monitoring pain, GI function and fluid and electrolytes, in balanced form. Nursing diagnosis. Acute pain related to peritoneal irritation. Deficient fluid volume related to massive shifting of fluids towards the intestinal lumen and depletion in the vascular space. Risk for shock related to septicemia or hypovolemia. Nursing care plan and goals. To reduce level of pain. To restore fluid and electrolyte balance. Prevent complications. Restore normal GI functions. Now let's look at nursing interventions. Nurse will be monitoring blood pressure and shock. Medications prescribed by the doctor would be analgesics and antiemetics. For pain management, there would be a prescription for analgesics, and remember to place the patient in the best comfortable position. Input and output. The nurse will record all input and output and assess fluid replacement. For IV fluids, nurse will administer and monitor IV fluids. Drainage monitoring. The nurse will record the character of drainage postoperatively. Evaluation. Has there been a reduced level of pain? Has the patient restored their fluid and electrolytes? Evaluating prevention of complications. Has the patient restored their GI functions? And lastly, discharge. Nurse to perform any patient teaching, especially teaching on care of incisions and drains. Maybe the patient might need a referral, possibly home care if needed, and any upcoming appointments. Thank you for watching this video. Don't forget to like, subscribe and click on the bell notification. Any comments or suggestions for future videos, please comment below.